Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each Tuesday and Thursday here on the Institute for Global Health's Facebook page. We invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or directly by email at globalhealthinstitute@northwestern.edu. And leading the discussion today, again, is Katie Burke, who is an intern this summer with the Institute. And Katie, I now turn it over to you.
Thank you so much, Kristen, and thank you so much, everyone, for continuing to submit questions. We really appreciate and enjoy answering them. And of course, thank you so much, Dr. Murphy, for answering these questions. So let's get straight into it. First, we have some headlines. A lot of big news last week about mask mandates, and should I or anyone who's fully vaccinated in Chicago be wearing a mask indoors?
Yes. If you're indoors with a mixed group of people where you either don't know their vaccine status or you're just uncertain, or the group is just so large you can't figure it out, it's safest to wear a mask. That's just indoors now. Now, if it's a small group of people you know, all of them are vaccinated, you do not have to wear a mask yet. But and assuming that they are also asymptomatic. So if things have changed a bit in the last week, as you know, but the data are there, and we've got to slow this thing down. Once this bump, this wave starts going down, we can loosen things up again. But right now, no, things are going in the wrong direction.
Mm-hmm. And related to that, is that now why people who are fully vaccinated are able to get tested for COVID earlier?
Yes, those things are tied. It turns out that, remember, the vaccines are not 100% effective. They're 90% effective. They are effective. So that's the important point to remember, Katie, and everyone. The vaccines work 90% of the time, but that means 10% of the time they don't work. But even when they don't work, they save you from going in the hospital. They save you from dying. Virtually no deaths in people who've been vaccinated. So it's they're working, but you can still get infected and transmit the virus, but in 10% of the cases.
Right. And with all of these restrictions, we know that COVID is surging in some places. And where is COVID surging a lot? Where do you see that?
Well, it's really driven completely by large pools of unvaccinated people, wherever they may be. You can go county by county, city by city, state by state. You look at the 5 lowest vaccinated states, you know, that's where really this thing is completely out of control. And most of those governors have been very responsible and have increased the promotion of getting vaccines, and it's working. It's working in places like Arkansas and Mississippi and Louisiana. People are starting to get vaccinated. They have a long way to go, but the number of people getting vaccinated now is going up. That's a very good sign.
Mm-hmm. That is definitely great to see. Moving on to some of our submitted questions from viewers. This really piggybacks off of your last answer, but now that more people are getting vaccinated, is there any chance we're getting closer to reaching herd immunity? And what will it take for this pandemic to end if a large group still do refuse to get vaccinated?
Yeah, well, this is really the question. When do we reach herd immunity? What is that percentage that we have to get to? We don't know. It could be 80, it could be 90%. We're really uncertain, but we haven't gotten there yet. Wherever we are, we're not there. But look at the states. If you just, and there's a lot of variation between states, including Illinois. Even within the city of Chicago, there's a huge difference. But you look at just the states that have high vaccination rates, they have a much smaller problem than those states with the low vaccine rates. So, you know, it's clear that we're going in the right direction and that the higher vaccine rates are associated with fewer infections, fewer hospitalizations, and fewer deaths.
Mm-hmm. Right. And because we had someone ask that the common cold is actually a type of coronavirus, not the same one we're seeing now, obviously, but they were wondering if that COVID-19 vaccine gives them any sort of protection against some of the common colds.
Well, first of all, coronavirus is just one of the many causes of the common cold. There's rhinovirus, adenovirus, other viruses, influenza can cause, well, that's a serious one. But I mean, there's many other causes of the common cold. Coronavirus is about 8% of the common colds. Unfortunately, there is very little cross protection. There's some evidence that one of the 4 strains of coronavirus that causes the common cold gives some protection, and maybe that's why the Africans have had less of a problem on a macro level because they have more of that type of coronavirus. We don't know if all that really is true or not, but I mean, these are just observations. But yeah, those the antibodies to the common cold coronavirus are not good enough to protect you from coronavirus, and the coronavirus vaccine doesn't really work against those common cold ones. So,
right. We had a lot of questions this week surrounding people living with groups of vaccinated or unvaccinated people. And some of the general questions that were coming in from that are, if, say, it's a child that's coming to visit, what sort of protocols should you be following with them if they're not a part of your immediate household? Or if an unvaccinated person is part of your immediate household, what are some of the risks that are coming along with that?
Well, if an unvaccinated adult or person over 12, unvaccinated person over 12 is in your household, everybody's at risk, because that person is so likely to get infected now because of the rate of transmission being so high. It's tough. I mean, how do you mask up in a house? It's really, really very difficult. The important thing is to try to get everyone in the household vaccinated.
Mm-hmm. To protect ourselves as well as we can.
Protect ourselves, vaccinated or not,
And just to clarify that getting a vaccine is stronger than the natural antibodies that you would get from having COVID.
Yeah, it's stronger and more predictable. The thing is, when you get people that get coronavirus, some of them get a very mild case and they developed a very weak antibody response, a very weak immunologic response. It's just unpredictable. So it's all over the place. Some are protected, some are not protected, and whatever. Whereas you get the vaccine, you get this, a regulated dose, a defined dose, and you get this response. It's very stable between people. And if you've had coronavirus in the past and you get the vaccine, you get even a bigger response because you have a little bit going on already. So the vaccine is definitely better than having COVID. It doesn't make sense, just thinking about it, you would think, oh, I had coronavirus, I should not get it. But right off the bat, when people started getting coronavirus, we said, oh, good, they get coronavirus, they're not going to get it again. Sure enough, within months, they were getting it again. So we saw the failures after as little as 3 months. So we know that there's more breakthroughs with the actual infection immunity than from the vaccine immunity.
Right. And another patient was wondering, they have Lyme disease, and they were wondering if it was safe for them to get the COVID vaccine.
Well, I'm sorry they have Lyme disease, and there's treatment for that, and presumably they're getting it. But yeah, they should go ahead and get the coronavirus vaccine. That's not a contraindication.
Mm-hmm. And has there been any evidence that any of the COVID vaccines have shown any negative fertility issues in men or women?
Absolutely not. Matter of fact, this has been discussed really in depth and is of course of an enormous concern. There was nothing in the animal studies before they started. There was nothing in the clinical trials even though there were plenty of women that got pregnant during the clinical trials. There have been studies of pregnant healthcare workers, thousands of them, and nothing showed up. There's been no signal. 163 million doses have been given out in this country already with these vaccines, and there's been no signal anywhere in the pregnant women, in women who've become pregnant or delivered a baby while getting this vaccine. Matter of fact, it's so safe, they're even saying pregnant women should get vaccinated.
Right.
That in pregnancy.
Mm-hmm. Yeah, that's great news to hear. Mm-hmm. Moving on, we have a question coming from someone who was wondering about the length of this pandemic and how the 1918 Spanish flu, for example, where they didn't have a vaccine or antivirals, was over within a year and a half, while this has lasted so long. And she was wondering why that might be.
Well, you know, how these pandemics play out, they have wave peaks and troughs and peaks and troughs, and all pandemics go away. The question is when and how many people are going to die. Remember in 1918, they didn't know that influenza was a virus. You know, I mean, they thought it was some mixture of bacteria or something. You know, they didn't figure out it was a virus until the 1930s. There was a lot to learn in that. And then you had World War I going on at the same time. And there was more of a focus on the war, which actually helped spread the virus than there was on the virus itself. And the mortality rate, in that, was terrible because it really hit people, younger people were more at risk for dying than older people. Older people were actually sort of protected a little bit because they had a lot of influenza antibody, even though they didn't know what influenza was. The herd immunity, we don't know. There's going to be waves. There's going to be waves. It is going to go away. And the way we get to herd immunity is through vaccines or everybody getting infected over and over and over again.
Mm-hmm. Which obviously one of those things sounds a lot better than the other.
Well, when getting infected over and over again, there's going to be a lot of people who get hospitalized and who die.
Mm-hmm. Yeah, which is very unfortunate. We had another person ask if Northwestern or any other medical center in the Chicago area is running any sort of vaccine antibody response study for patients with blood cancers.
Not to my knowledge. I know they're going on nationally, but we'll have to look that up, and we can bring that up after we do a little investigative work. Maybe some of the other centers in Chicago are doing it. I'm not sure.
Mm-hmm. And this is a kind of a more specific question. So a patient has received several positive ANA tests that were substantial according to her doctor. However, they've not yet been diagnosed with a immunocompromising disorder or anything. But without a diagnosis, do you think it's safe for this patient to receive a COVID vaccine?
Yes, the Rheumatologic Society of America has a lot of information on this and the other immunocompromised diseases, and the vaccine is still recommended in all these people.
Mm-hmm. Great. And this is kind of related to some of our headlines, but a family has planned a trip to Florida from the time that COVID was kind of tapering off or relatively stagnant. And all 4 of the adults have been vaccinated, but there are children in the group who cannot be vaccinated. And they were wondering, with their vaccinations and the precautions of masking and social distancing they plan to take, are they at a better chance of not contracting COVID or generally safer than unvaccinated folks?
Florida accounts for 20% of all the COVID in the United States right now. It is completely out of control there. They are doing anti-mitigation regulations and rules not to wear masks, just kind of forget it that everybody's getting COVID. So I think Florida really is a no-go state right now until things calm down there. You got to watch the numbers. Right now, they're completely out of control.
Mm-hmm. And
not a good place to go right now. Plus, it's awfully hot there in the summertime.
Right. I know we just saw that they had a record number of cases since the beginning of the pandemic in that state over the weekend. So that's very concerning for travelers.
Terrible. Some of the hospitals, especially in the rural counties, are full. And the ICUs are full. If you got sick down there, it would be a catastrophe.
Mm-hmm. And our last question comes from a submitter whose child just received their permanent residency in Canada. And because of the way the vaccines in Canada are being rolled out, she and her husband both received Pfizer for their first dose. But because children under 12 are soon going to be approved for vaccines in Canada, the government is saving those Pfizer vaccines for them. So they're actually getting Moderna as their second dose. And they were wondering if mixing 2 different vaccines affects the efficacy of the body's antibody or immune response.
Yeah, well, this is a good question. The vaccines are very close, but they're not the same. And the recommendation is to say, take the same one if you can. However, in the United Kingdom, when they were having their big wave, not the current one, they're actually going down. But when were having their big wave, they did not have enough of the same vaccines to keep giving everybody the same one. And they started this whole mix and match thing. So the theoretical advantage is that you actually get two kind of sets of antibodies. The one study that I've seen showed that the efficacy was about the same, but that they had actually the side effects from both. So they had actually more minor side effects, but overall it was okay. But it's not recommended, but if that's the only thing you can do, you should definitely take 2 shots, particularly if you're sticking in the same category. So Moderna and Pfizer being mRNA vaccines.
Mm-hmm. Well, thank you so much for your time, Dr. Murphy, and thank you everyone again for watching and submitting questions. We look forward to seeing more of those. Thank you again.
Okay, see you next week.